It's campaign time in Ethiopia's Somali region, and health workers Ermias and Salah are on a mission. They are going from house to house to immunize all children under 5 years of age with 2 drops of the polio vaccine. Ermias and Salah are one of many teams working hard across the country to ensure a successful immunization campaign. Vaccination is essential to prevent polio, a crippling, disabling, and potentially fatal disease which can be contracted from person to person. Ermias and Salah ride their motorcycle to the next settlement. Children are vaccinated and have their finger marked with ink, indicating they have been vaccinated during this campaign. Even children coming from Somalia or leaving Ethiopia to cross the border receive vaccination. Nemo Alele, head of the Aubare Health Center located near the border with Somaliland, explains.
All the children under 15 years of age who cross the border from Ethiopia to Somaliland or the other way are vaccinated. This is a border area, and we explain to the mothers very carefully what harm can happen if there is a transmission of the disease. We have good relations with our counterparts in Somaliland and have discussion on a monthly basis. There is a similar vaccination center on the other side of the border, and we are both committed that no child should cross without being vaccinated.
Success for polio eradication starts with individual commitment. Such commitment can be seen in grandmother Sofia Ego Bulale, who lives in the nearby village of La Fiesa, as she talks about her 3-month-old grandson, Hamad Mukhtar Daib.
I travel back and forth between La Fiesa and Hargeisa with Hamad. We didn't have this vaccination when I was young, and I have seen children who grow up disabled as a result of polio. I am therefore happy that vaccinators come to our house to make sure that my grandson will be protected, whether he is here or in Hargeisa.
Ensuring all children are immunized is not an easy task. Millions of doses of the vaccine have been procured, shipped, and distributed to every corner of the country. Communication and social mobilization brings information about polio, routine immunization, and child health to communities. Health worker Ermias shares his experience.
In the past, when we informed communities about upcoming campaigns, because they didn't have an understanding about it, some would refuse to bring their children forward. But today, we vaccinated an infant who was born today. In the past, that would be unheard of. Now, if they have a child at their farm, when we come for vaccinations, they will tell us we missed one and to come back the next day.
It is through the leadership of the Federal Ministry of Health and the generous support of polio donors and partners that more children have been reached with the polio vaccine, and Ethiopia is now polio-free. In partnership, alongside communities working together, we can ensure polio transmission remains at 0 in Ethiopia.